a lot of times the patients and their families are looking at us as their primary care physicians to sort of be a person to sort of have control and confidence over the information with regards to if there's issues with discrepancies in medications.
Knowing it all. I think you do, yeah.
Because there's either going to be, you're going to have three scenarios. You're going to have no list, or a list, and then there's change in list. Our younger patients are easier to take care of. They tend to have lesser complex medical needs. They may just be on 1 or 2 medications. And I'll see a young guy or a woman come into my office and I'll say, what are your list of medications? And they'll flip out some small little piece of paper, you know, like from the wallet, fold out of my wallet. Okay, there's my list of pills, doc. And that's pretty easy. It's just 2 or 3 pills. And that's not too hard to sort of reconcile. And that's another word that we use is reconciliation. The hospitals use that word now.
Right.
And that means...
And that's big.
When you go into the hospital, what are the list of medications are you actually on? And when you go home, what is the list going to be when you go home? And if there are any discrepancies, they need to be addressed. And oftentimes, as Mark was describing, with the advent of hospitalists taking care of a lot of our patients in the communities, that sometimes makes it a little more complicated. Mm-hmm. And then if you bring into local skilled nursing care facilities, and then we just get lists and not real time. And then oftentimes the families present themselves with their parent, and they're expecting us to be right there in real time with what's going on with the actual medication situations they may be on. And that can be frustrating.
Yeah.
Because you don't want to, you want to be in a position where you feel that you can provide competent and quality care to your patients and their families, and also feel that they can feel confident in you as a physician taking care of them.
In order to do that, you need the information, though.
You need the information.
Yeah. So, do you have any stories about safety issues that maybe a patient came into your office
Sure.
and because... All right, why don't you share one of those with us?
Well, this is a simple explanation. This could be a new patient of mine, and they come in and say they don't have an actual written list, but they come in with this sort of generic pill case, and they come in and they have, all right, those are my medications, doc. And I'm like, all right, it's a green pill, that's that.
Yeah.
And you don't know what those medications are. And then that's where you have to get on the telephone and get old medical records. Hopefully there's a family member that can provide information, or a pharmacist that can provide information. And you're kind of like, you don't really know what to do with that.
Right, because sometimes the patient doesn't even know.
That's the extreme situation. Then you get informations where people will just come in and, one of my classics, and I see this a lot, is envelopes. They just have it written down in an envelope, and you can make sense of this. And then the issue is this still the real-time medication? Because as you may have been explaining previously, that these things change. Mm-hmm. When patients of ours end up in hospitals, hospitals tend to print out things. And now that we've become more electronic, the lists have now become computerized. And you get these nice computerized lists, and some of the hospitals provide very nice computerized lists, where it's still there's still room for human error. Basically, a person will be in the hospital, and they have basically a printout of the medications they are on. And then prior to the discharge, they print up the paperwork, and the hospital doctor goes through the list and either circles yes or no, and then writes prescriptions.
Right.
And then, provided what I was saying previously is transparency. What is the time lag between the actual preparation of this list and the medications that are generated from this list, and the lag of time that may be, it could be a few days or it could be a week or so before they show up in your office.
Right.
And you're not even sure if they filled the prescriptions or not.
And then they go home with their new prescriptions, and they have all their old prescriptions at home, so they're, maybe they shouldn't even be taking some of those.
Well, then it gets really even nicer. Then the VNAs are getting better at this before.
Oh, this is nice. This is from the VNA.
A lot of times what they would just do is call up the office and say, Dr. Maggio, I have a patient of yours that was recently in the hospital or had a brief stay at one of the local skilled nursing facilities. I just want to have some questions about some of the medications. And they go through the list, and fortunately now that we're electronic, it's very quickly, you're able to get onto the computer very easily, and you can review the medical, their medical chart right there. And if we had something like a personal medical record, it would even be amazing. And so you're going through the list, and you're saying, well, I want to cross this one out, and then I want to cross this one out. And then by the time the person comes and see you, list is gone, and you have to make a new list.
Right, right.
Because what ends up happening is you see the person in the office, and you make further changes because you're trying to reconcile what medications they were on previously and what medicines they may have been introduced during their recent illness.
Stays at wherever, yeah. So the Rio will allow you to do that right in office.
And then if you want to make changes, that's what's nice. Then or the bigger problem is also with specialists. Not that specialists are not a problem, but I mean the information is not often communicated in an effective manner because my local cardiologist or endocrinologist or whatever specialist makes an appropriate medication adjustment based on whatever their medical issues are. And what the standard procedure is, you wait for either a follow-up visit or the consult note to be sent to you within about a week or so, and then you review the note. But still, that doesn't provide a solution of reconciling any differences in terms of updating the information.
And it doesn't help the specialist either. If they had this access to this, they could just be right in the system looking.
And it works both ways, definitely.
Right. So this is really a need for this. Let's go to this last clip right here that we were looking at.
Okay, this clip is the Personal Health Record Bank. Notice the word bank. I say bank because what do you do in a bank? You store things in it. You make deposits, you make withdrawals. So it's not just about a record that you have, but it's some central place where you can put your records. So you can envision the Rio can sort of function as that sort of bank because it is a electronic health information exchange.
Right.
So within that exchange, you have infrastructure where you can store all this information. So a patient can access their records. So basically, your records are being maintained by your doctors, your hospitals, places you go to. You yourself can add to your record. You can say, this medication gave me headaches. I had this symptom, and then I developed this rash. So you can add those little bits of information that you may want to add about your own health. You can in the other end, you can also take information out. In other words, you want to find out what was the result of your last x-ray, what was the result of your last test. You can pull that information out. So there's a whole bunch of activity happening around your record. So your record is sort of like a bank account. It's growing.
Right.
Transactions are being made. But you have the security of knowing that at one place your records are safely stored, that you can go anywhere in the country, you can end up at any hospital, but you have the security of knowing that all your health information is stored securely and you can have access to it.
In one place, right.
And your doctors have access to it.
Right, most importantly, yes. Health professionals have access to it. How would a patient access it? They must have a password, right?
Yeah, you can imagine it like a web page. Like the way you access your bank account, you would get onto your bank, Bank of America, Bay Bank, whatever it may be. You get onto the website, you log on securely, you transfer money around, doing a lot of secure things, a lot of things that you would want to have secure. The same thing in a personal health record bank. You should be able to do this all securely without any information lost in transit.
Lou, do you think a lot of your patients would use something like this if it was out there?
I think also...
Are there caregivers?
There caregivers are certainly the majority of people that I would see using this idea, because a lot of my elderly patients are intimidated by computers. They certainly, a lot of them do have computers at home. Somewhat of a significant amount of them have internet access, but they find the concept of getting on the net very intimidating.
But the baby boomers won't.
No.
Yeah, and
I think they're the ones who have the responsibility of caring for their senior parents.
Right now, yeah. Yep.
And also, I imagine with this concept, as the primary care physician, we would be able to see if the changes that are being made, so we know what changes are being made to our